Good evening and welcome to our webinar this evening on the first 2000 days, conception to age 5. We have a couple of presenters lined up for you this evening, Associate Professor Elisabeth Murphy, and we have Justine Salisbury, who will be doing a presentation on the Get Healthy in Pregnancy after we've heard from Associate Professor Elisabeth Murphy. Before we get started tonight, I would like to acknowledge the people of the Barkindji Nation and the different nations on which the people here sit today. We would like to acknowledge that we work on the traditional lands of many Aboriginal clans and nations, and I pay respect to elders past, present and emerging, and acknowledge their continuing connection to land, water and culture, and for their contribution to help shape the life of the communities in which we all work and live. We recognise that sovereignty has never been ceded, and are committed to working in the spirit of partnership and collaboration with our region's Aboriginal communities and peoples to improve their health, emotional and social wellbeing. We welcome Aboriginal and Torres Strait Islander Australians who are present in this meeting. And I would also like to acknowledge that this education session is a result of a successful collaboration between the Western New South Wales PHN, the Far West LHD Health Promotions Team and the New South Wales Ministry of Health. Now, I'd just like to introduce to you Associate Professor Elisabeth Murphy. Elisabeth Murphy is the Senior Clinical Advisor, Child and Family Health, New South Wales Ministry of Health. She has overseen the implementation of a number of early intervention programs designed to lead to improved health throughout life, including New South Wales-wide evidence-based screening programs for hearing and vision, Aboriginal maternal and infant health programs, and promotion of health checks for improved child development and health in the New South Wales Personal Health Record. Concurrent with her ministry role, Associate Professor Murphy works in Northern Sydney Local Health District as Network Director for Child, Youth and Family Services. And now I would like to hand over to Dr. Murphy for her presentation. And please put your questions into the question box so we can have a bit of a QA session at the end. Thank you.
How are we going? Do we see the first 2000 days of life?
It's looking beautiful.
Fantastic. Okay. Well, thank you so much for the honour of speaking to you tonight. I want to thank all of you who've no doubt had a big day today, to giving up your time to be here to listen to this new evidence, this new emerging evidence of this 2000 days of life. I must say I was quite overwhelmed when I found out about the size of your PHN, from Bathurst to Broken Hill and from Balranald to Burke. It's a massive PHN. So wonderful, though, that so many of you have chosen to come and listen to this evening. So Justine and I are very excited and hope that this talk that we give gives lots of evidence so that you are interested and have lots of opportunities for questions. So let's begin. And just to clarify that when we talk about the first 2000 days of life, we are talking about from conception to the age of 5. Now, it always interests me about how much we concentrate on CPR training, on airway breathing and circulation, how much we all learn the latest with regard to CPR. And whilst I'm not negating how important that is, I also think that the breath for life is as important as us knowing more about the brain for life. And that's what all of this first 2000 days new evidence is about, that 90% of a child's brain and of an adult's brain develops before the age of 5, from conception. And the influences that can impact on the development of that brain are not well known. And so we're hoping that with this first 2000 days initiative, people will understand the importance of building that brain for life, building a brain that gives every child the best opportunity to live, love and learn and reach their fulfillment, and acknowledging how much of that building is occurring when 90% is occurring, which is before the age of 5. And I consider this isn't well known in the community. with so much focus on later educational efforts, rather than really concentrating on the structure of the brain and how it's built in those first 5 years of life. Because we have doubled the number of days where there is a life expectancy from the previous century. It was about 17,000 days. Now we expect a child born in 2013-15 will live approximately 30,000 days. And what we do know is that those first 2,000 days from conception to school entry will inform the future 28,000 days. Tragically, we also know that an Aboriginal or Torres Strait Islander child born at the same period is not expected to live as long. That this is the work that we're doing with regard to closing the gap, and with this first 2,000 days, trying to address that and hopefully making that difference. So if you think about the way we invest in super, that the earlier you invest, the longer that you'll reap those rewards. It's the same for the brain. The earlier that we invest in those first 2,000 days from conception to school entry, the more that there will be results for the rest of our life. And I just want to acknowledge that a lot of this is new evidence, increasing evidence building one on top of the other in the last 20 years. And it really is unbelievable in a way that it is so new. But if I look to documents from just 20 years ago, we would talk about adult diseases that have their origins in childhood or adolescence. And if you think about that as a national goal, it's almost excluding the first 2,000 days. So it consolidates how new this evidence is. And the reason why we have chosen the first 2,000 days, rather than, you might be aware, in the medical literature in particular, they talk about the evidence of the first 1,000 days to the age of 3. We consider that it's important that that full 90% is still that opportunity for brain plasticity. And it also incorporates that very important part that we know is strongly evidence-based of 1 year of preschool before school entry. So we wanted to make sure that we included that. And that's why this New South Wales health policy is to the age of 5. And just a warning, because one of the things that can happen, because I know all of you have a lived experience of your own personal first 2,000 days, and some of you might even be responsible as parents or grandparents or aunts, uncles, friends, that some of this you might take to yourself and think personally. All of this evidence that I'm talking about today is public health evidence. None of it represents individual advice. And each part of it is just part of the puzzle, this wonderful intricate tapestry that's giving us more and more information about this brain development. And remember that no matter how upsetting or worrying some of this evidence may be, that risk is never destiny, and there is always the human capacity for resilience. And so we'll run through a new ABC, not airway, breathing, circulation. We're going to do antenatal care, brain development, and childhood experience, remembering that all of this is supported by data and epigenetics. But we're just going to focus on those 3 parts of the evidence tonight. Now, antenatal care, there'll be 3 aspects that we'll look into with the antenatal care: physical health, psychosocial health, and future health, both physical and mental. And what does that antenatal period tell us about the health of that child and indeed adult? Now, I think it's been well known and understood that the physical health of the mother will impact on the structure or the physical health of that fetus or baby in the womb. The obvious example is folate, a water-soluble vitamin, not inadequate levels prior to conception and in the first weeks of that pregnancy, leading to the catastrophic consequence of spina bifida or anencephaly. And it always impresses me that that balance that's required. You know, folate is just one small nutrient having such consequences with regard to spina bifida. When I trained, there was a whole ward at kids with spina bifida and anencephaly. With a public health campaign, we have turned that around to it's probably not being seen by doctors of the future. However, we have a new issue, and that is overweight and obesity in pregnant women, often leading to gestational diabetes or gestational diabetes occurring, and that leads to impaired glucose tolerance in that fetus, and that baby is set up in an obesogenic environment. And that's why I think it's important that we've got Justine as partner talking about Get Healthy in Pregnancy tonight as part of this presentation. So I think it's been well understood for a long time that the physical health of the mother will impact on the future physical health of that baby, child, adult. But I don't think it's so well understood about the mental health of the mother, the psychosocial health of the mother, impacting on that future child behaviour, mental health of the child. And so we're just going to look at that in 3 layers. And so the first layer is normal mental health, normal psychosocial health of the mum, and as can happen in life, stressful life events. Now, this really fabulous study comes from Western Australia. It's called the Raine Study. It's a great website if you want to go to it. In 1989-90, 2,890 women had every aspect of their pregnancy documented, and they have followed up these babies now for many decades. And as I say, it's really an exciting website with all the different aspects that are documented. But the one that I want to talk to you about tonight is the one that's looking at stressful life events that happened to the mother during the pregnancy. And they looked at the number, the type, and the timing of those stressful events. So if you have a look at here, these are the kinds of things they documented. Moving house, well, it seems like most pregnant families tend to do that, so tick 1. But there are other things that can happen like job loss or problem with other children or a relationship problem or a problem in the pregnancy. So they documented that and then followed up those children with a child behaviour checklist at 5, 8, 11 and on into adolescence. And if you have a look here at the odds ratio of those children having an abnormal result on the child behaviour checklist, you can see up to about 4, it gets contained, but after 5, the chances of those children having abnormal child behaviour as manifest on the child behaviour checklist is significant. So that's the first group, normal women with stress. The second group is what can happen as a result of pregnancy. And so this is anxiety or depression induced by the pregnancy. And we know it's common. It's 1 in 10 women antenatally and 1 in 7 postnatally women will have depression. That's 15,000 women every year in New South Wales will get depression as a result of the pregnancy. But it also affects dads. 1 in 20 fathers in the pregnancy, 1 in 10 postnatally will struggle with depression following the birth of their baby. That's 10,000 new dads every year in New South Wales. And one of the reasons why we include an Edinburgh postnatal depression scale, postnatally and antenatally for mothers, trying to identify those parents that are struggling with depression that is pregnancy induced. And then finally, the next layer of mental health is a study, a linked data study from Denmark, where they looked at women who actually had clinical depression and were on medications for their depression. And they looked at a control group and they looked and linked that to children at the age of 7, and they undertook a strengths and difficulties questionnaire on those children. And you can see in the red bar the future outcomes for these 7-year-olds where mums didn't have depression. And these were their results on a strengths and difficulties questionnaire. You can see a difference with the mums who, but not a significant difference, with the mums who had depression and took their antidepressants. But as we know, many women will not take antidepressants or indeed other medications during pregnancy because they're worried about the effect of the drugs on that baby. And you can see in that green bar the abnormal results with the untreated depression manifest by those children at the age of 7 with a Strengths and Difficulties questionnaire. So we're building up a picture that the mental health, the psychosocial health of the mother during the pregnancy is informing the future psychosocial mental health of that child or adolescent. And indeed, this has been consolidated by a recent study in a year ago in Victoria, where they looked at mums who had children who had those babies that had severe and persistent infant sleep problems, and they were linked to those mothers having poor mental and physical health during the pregnancy, and that was linked. So now we're up to the third component of what's happening in the antenatal period, and this is this new field called DOHAD, Developmental Origins of Health and Disease. And this all began with Dr. Barker and a Barker hypothesis, as it's now known. And his hypothesis, which was quite heretical at the time, was that low birth weight was linked to the earlier onset of adult heart disease. And to do that analysis, he wanted the birth records because he knew there were very accurate birth records in this little shire, Hertfordshire in England, and he wanted to link it to adult heart disease and look at this linked data. And he actually, as a little medical anecdote, he had trouble getting access because of confidentiality to the birth records. And then he was told, no problems, because he had his sister who was born in that cohort when their family moved from the Blitz in London. So if you ever have problems getting access to records, obviously that was something that worked for Dr. Barker. And you can see here, indeed, that graded response, that the earlier onset of heart disease, coronary heart disease, was indeed related to low birth weight. And so began that thought about physical disease being related to what in later life being related to what happened in the womb. Now, here's an example of mental illness presenting later in life being related to what happened in the womb. And so this is a study that happened with regard to the Dutch famine of 1945. And you can see just for 3 months of the pregnancy, that middle bar group of women who were exposed to the stress and nutritional issues of the famine. And you can see the consequence for those babies, well, actually for the boys at the age of 20 plus years, was a much greater risk of schizophrenia and schizoid illness. So all of this layering impacting on our understanding of that blueprint happening for the trajectory of later illness being related to what happens in the womb. And indeed, that is the quote that I've got up there on the screen from Professor John Newman, the Senior Australian of the Year. And even now, how little is known about what happens later in life and the impact of those first 9 months. And I'm just wondering now whether when you see an adult presenting with cardiac disease, do you ask about birth weight? And increasing this field of DOHAD has more and more adult disease that can be linked to what happens in these first. Whether we should be looking at a strengths-based approach and about keeping women well, stress-free, happy even in pregnancy, because if this can happen in a negative way, what effort do we need to start putting this in a positive way? And how much influence do we have as far as that's concerned? And that's why I think that the Get Healthy in Pregnancy is a great initiative, because obviously if women are feeling like they are a healthy weight, especially pre-pregnancy, that's going to make a difference. And one of the things that I'm hoping will make a difference, if you like, with precision medicine, is that we are going to get accurate documentation now with the work that we're doing with the electronic personal health record. And I know that Western New South Wales has general practice that are participating in this wonderful new initiative, because it means that there's real-time documentation among the parents of the child, and there's accurate documentation, so that if you're seeing this child later on as an adult, you really will be able to get that accurate history as to what's happening in the pregnancy, because this is a field of medicine that I'm sure is just going to explode, and one that it will not, really get to the results that we can from a level of precision medicine if we don't have that accurate documentation. So an exciting and emerging clinical field for us to watch for the future. So we've passed A, we're moving now on to the brain and the brain development, so the second part of the evidence. And I put up this slide because I think more than any other people in Australia, you have the most wonderful night skies where you live. And I put up this image of the Milky Way for you to think of neurons in the trillions, recognizing that none of those, 50 trillion are connected by birth, determined by the genes from the parent. But the connection of those neurons, if you think of those stars as being unconnected, and that all of those connections are going to happen in the first years, we're going to have 1,000 trillion connections, all determined by that baby's experience. So those experiences are going to determine which neural pathways are formed. And if those babies don't have that stimulation, what pathways are not going to be used and are going to fade away. And the experience will wire the neural channels. We call it serve and return. And so if that baby is surrounded by predictable, loving emotions with great attachment and affection and a stable pathway, then those are the neural pathways that will be developed. As opposed to a baby that's surrounded by domestic violence, anger and aggression, and those are going to be the neural pathways that are developing. So how important is the adult carers in those first years of that baby's life? They're actually determining the neural pathways that are going to be developed in that baby's brain. And it's all there in the head circumference chart, in the personal health record. Just look how steep that graph is in that first year of life, and think that that is the baby's brain growing as a result of the stimulation that that baby is receiving, and in particular from primary caregivers. And that rapid growth of that brain as represented by the head circumference chart. And just look at how steep it is just to the age of 2. And indeed, a lot of the understanding that we have about brain development has come from the Romanian orphanage study. And for those of you who may remember, this was the opening of Romania after the Ceausescu regime, where children were found to have suffered extreme neglect. And then we have done longitudinal studies on those children in the UK and in Canada, and we followed them up to 20 or 30 years. And we found that with PET scan evidence, that on the right hand, you can see that there just isn't any brain activity, that the brain just isn't built with those children who suffered extreme neglect, as opposed to a healthy brain on that PET scan on the left-hand side. And indeed, we found that 80% of the children that were adopted after 6 to 8 months never developed the opportunities of being able to live, love and learn. The majority, 80%, as I say, having some kind of mental health diagnosis, not completing school, often ending up in the juvenile justice institution. 20%, no matter what life threw at them, went on to have a normal life as we would want, but unfortunately 80% did not. Now, the other thing that we found as a result of the Romanian orphanage study and these longitudinal studies is there's critical window periods for things to happen in an orderly way for brain development. Now, an easy example that you can see here is vision. So we check the baby before it leaves the hospital to make sure that it doesn't have a cataract in its lens, because if it does, then the stimulus that brain needs, the visual cortex needs, is light to form the neural pathways so that child learns to see. And we know that that period wanes after the age of 5 or 6. So if that is detected later, if there are problems detected, amblyopia detected much later than 5 or 6, then it's too late to be able to help that child to be able to ever see in that eye. And that's why we do the STEPS vision screening at 4, trying to detect the amblyopia at a time when we can still create the neural stimulation for that brain to develop to be able to learn to see. So it's got nothing to do with the eye, it's got to do with this critical window period for the brain to develop. And SWISH has revolutionized communication because that child now develops the ability to hear and develop from birth, as opposed to the age of 4, which happened before the newborn hearing screening came in. And just have a look at that graph with regard to human brain development. How much of it wanes after the age of 5? So just more evidence about the importance of the first 2,000 days and the critical window periods. Indeed, now an excellent UK study has shown that if we look at a child's developmental score at just 22 months, we can accurately predict educational outcomes at 26 years. 22 months predicting 26 years of age. And that's why developmental assessments are so important, that we should be looking at doing them opportunistically to make a big difference. And indeed, we know now that with linked data from the Australian Early Development Census, which is developmental assessment done on all children every 3 years at entry of school, we link that to NAPLAN data, but there is no difference. So the way those children arrive at school at the age of 5 will predict their NAPLAN outcome and will, of course, predict educational outcomes later on. And this slide, I just wanted to, I think, consolidate this information with regard to brain development and mental illness. If you have a look at the top band, that looks at when mental illness is diagnosed, and you can see most of it is being diagnosed at later years of life. But have a look at when the brain is developing, and you can see that development of the prefrontal cortex and the cerebellar cortex. And you can see, I think it's just a great image to me about when the brain is developing, which is in this early years, as opposed to when mental illness is manifest. So if we really want to do something to prevent mental illness, it's too late in a way when it's presenting. It's got to be when that brain is developing, which is much earlier on and in the first 2,000 days. And indeed, there are studies now where a mother has prenatal maternal depression, often as a result of child abuse that she takes into this pregnancy, where they've done MRI scans to look at the prefrontal circuits that have not developed in these children to, if you like, contain the amygdala. So these children are arriving at birth, if you like, more wired, not able to suppress the amygdala. And then finally, I just wanted to talk about one study the Adverse Childhood Experience Study. So we're on to C, and this is a study that looks at negative experiences in early life can have long-lasting effects that can be difficult to overcome later. This is a study done by Vincent Felitti and the CDC, but made famous by Nadine Burke Harris and her TED Talk. And if you haven't had a chance to look at her 15-minute TED Talk on the ACE study, I would recommend that you do. So this study was, the issue was discovered by Vincent Felitti, an adult clinician, where he had a whole group of patients that just didn't do as well as others, got sicker and died earlier than another group of patients. And he couldn't understand why until one day he accidentally asked a wrong question on history. And instead of asking the correct question, he asked this woman what weight she was when she was first sexually active. And the woman said 40 pounds. And he said, no, I said, you know, what weight you were. And she said, yes, I was 40 pounds. I was a victim of child sexual abuse. And so then he started asking other patients and got a similar response, which led to him doing a major study on 17,000 people living in San Diego, privately insured with Kaiser Permanente. So these were not people on the, you know, in backlots or poverty, and found a strong and graded response of those people who didn't do well being linked to those who had adverse childhood experience in their background. So we developed the score out of 10, and the score is got via 3 for abuse, emotional, physical or sexual abuse, 2 for neglect, either emotional or physical neglect, and 5 for problems in the household, such as domestic violence, substance abuse, mental illness, parental separation, or an incarcerated parent. And indeed, the evidence from this study, which has been consolidated by many studies now in other countries, is that if someone has an ACE score of 6 or greater, the prediction is that they will die 20 years earlier than those who have none. But indeed, ACEs are common, and 1/8 of the population have more than 4 ACEs. The mechanism of adverse childhood experience is that there's social, emotional, and cognitive impairment, adoption of health risk behaviours. However, even without the adoption of health risk behaviours, the disease, disability, social problems, and early death is apparent. And you can see on these graphs, there's an impact in early life and also an impact in later life once you start to get a higher ACE score. And the mechanism is stress. Brief increases, you know, is a positive experience. We need babies to be exposed to stress. But the very important part there is that it's tolerable stress. It's buffered by supportive relationships, that primary caregiver. There's an issue when there's toxic stress, when that child is set in flight and fright, when anything can provoke a freeze response or a total flight and fright response. And if you imagine that that cortisol is turned on at a time when they're developing their neurological system, their endocrine system, their immune system, they are set neurobiochemically at this level. And then, of course, if they try drugs in adolescence and feel calm or normal, as we all feel for the first time, there's no point in saying to that young person, drugs are bad for you, because they've just felt normal for the first time in their life. But it changes the story of the drug addict or the suicide attempt, or if we start thinking, or someone who seems to be, you know, why do you smoke so much? Because we changed the rhetoric from what's wrong with you to what happened to you? Tell me your story. What happened to you? And I wonder if in the future an ACE score will actually be a core component of every clinical assessment, so that we understand the big risk factor that might be there with the adult who's sitting in front of you with whatever disease it may be. And then finally, before I complete this section on the evidence, I just want to mention, of course, COVID, which has had a significant impact, and in particular, impact on mental health. This is a national poll that has found that almost half of parents report the pandemic has had a negative impact on their mental health, and a third think that it's adversely affected their child. And I was quite shocked by this final figure, that 1 in 4 parents reported not having enough money to buy food for their family. So COVID has had a significant impact for the negative. But one of the things that really excites me in the context of first 2,000 days, if we can get this information out to the community, is look what's happened as a result of community education for COVID. The general community have understood incubation periods, infectivity. There's been an amazing community response, and look at the outcome that we have here in New South Wales now, with I think 0 reported now for the 11th day in a row. And that's something we've done as a community, and I think that is something that we need to think about as a community as to what we need to do to improve the outcome for the first 2,000 days. So that concludes the evidence. So we've now understand the mechanism of the importance. We know the anatomy, the biology, the chemistry, we've got data linkage proof, and we know about the epigenetic changes. And if we understand the anatomy and biology and the mechanism, we can understand the interventions. And the most important intervention is these, that we need to make sure, this first one about attachment. We need to ensure that where there's opportunity for brain plasticity, we work on that. We look at what we can do to promote good cortisol, resilience, and how can we work with the community and change epigenetics for a positive. And this is a pause for humour, if you like, about the attachment I have with my dog Bonnie. That's Bonnie and I in mutual gaze. And can I assure you how protective it was when my Bonnie ate my very expensive glasses, my mother's very expensive hearing aid. And I won't tell you about how she managed to damage an insulin pump. But we were so attached, Bonnie and I, that she survived to adulthood. And I think that's, in a way, what we'd want for every baby, every new baby born in New South Wales, that wonderful, loving attachment. But attachment is also used in NICUs. This is from Scandinavia, but just the physical touch is there, and these little preemies have got the skin-to-skin contact that happens in those NICUs, and indeed the outcome is those babies growing faster and leaving hospital earlier, all of which is part of our first 2,000 days. We've got 3 objectives, and we'll go through each one of these in this part of the talk. So the first one is that we want everyone in the New South Wales health system to understand and promote the importance of the first 2,000 days. None more important, I think, than general practice, because you are in such a pivotal position in knowing families, knowing generations of families, and being such trusted health professionals, that important information that you partake is going to be acknowledged. Now, we've got a long way to go, because there's a study that's helping us understand what the general public now thinks and understands about the importance of the first 2,000 days. And you can see here, just highlighted in green, how much research these people did to find out that all of what I've just talked about is not understood. People think that children's worlds are idealized and distinct from the world of adults. So rather than the impact of adults is forging the epigenetics for positive or negative, forging neural pathways, they think that their child is in a bubble, their world is idealized and distinct, and what adults do is not going to affect them. They feel like a child can't experience anxiety or sadness or depression, that they don't have any mental health issue. And they also think that the play will be a natural state, and that the most important worrying aspect, though, I think, is that they assume that words are necessary for cognitive and emotional development, and not for how much that is happening before that child starts to have words. And here is something that I found quite interesting, where if often when in the ministry we say, oh, we should introduce a parenting program, and that's viewed very negatively. Have a look at that. That's in the black, because parenting is considered a private matter. People should parent the way that they want to parent, and if they're vulnerable and need extra help, well, really that's their problem. They got into this problem, they need to sort that out themselves. As opposed to us saying, no, we want to do something to promote your child's development. And that you can see in the orange bars is viewed very positively. Here's an example of something where I think just getting the information out of the importance of the first 2,000 days and the various aspects of it is going to impact and make a difference to brain development, for one. So this is about when families decide they're going to plan to end the pregnancy before full term, before 40 weeks. They're going to plan a Caesar with no medical or obstetric indication. And you can see 42 to 60% of babies that are born early for a social reason, not for a medical or obstetric indication. And this has led to babies needing to be transported by nets. And so we've done some work with the marketing on a program called Every Week Counts to try and get the information out there that every week counts. And so this is the brochure that's available that demonstrates that for every week before 40 weeks, you are increasing the chance of that child having learning difficulties at school entry and that child having problems needing to go to a special care nursery. Because if you have a look at that column with the baby's brain, it demonstrates that a third of the weight of the brain happens in the last 5 weeks of pregnancy. A third of the weight of the brain in that last 5 weeks. So the best place for that to happen is in the womb. And yet we know that people will make choices that are different for no clinical reason. Obviously, it's never an issue if there's a clinical reason in the mum or the bub. So the second strategic objective is that we need to provide care to all. And once again, as I say, none more able than you in general practice. And we're looking here at linked data that shows how important these early years are, and in particular, I think, for developmental surveillance. Now, in New South Wales, now we're using Learn the Signs Act Early. It's in the personal health record. It's translated into 19 languages. We've developed resources for PHNs to use this resource. And yet we have now a situation where 1 in 5 children, 20% of children, are arriving at school developmentally vulnerable in 1 or more domain, and 10% in 2 or more domains. And we know that when they arrive at school that way, that's going to impact on their learning. So we need to look at how we can promote developmental surveillance. And one of the concerns we've got is children being placed in front of screens. And this is a beautiful 30-second video, which I won't play because I don't want to risk everything collapsing, but you can look at it later on, where it demonstrates the little blue monster is the child's brain, and it lights up when the father is in front of the baby having an interactive relationship and goes to sleep when the baby is placed in front of an iPad, trying to emphasize that brain stimulation occurs by, in particular, a loving face rather than an iPad. But it's not just babies that are being put in front of screens, it's parents that are looking at screens instead of looking at their baby. We want parents to switch off their screens and switch on to their baby. And to assist with this, we've developed a wonderful resource called Love, Talk, Sing, Read, Play, because we want everyone to love, talk, sing, read and play with their baby. That's now in the baby box that's given to every baby born in New South Wales. It's a wonderful resource because parents might know in particular what to do with a 2-month baby or a 6-month baby or a 2-year-old baby, and it's all in that flip chart so that parents can look at that and get the understanding of what to do. And then finally, the third objective, and this is that we need to provide extra support for those who need extra help. And there are three particular issues that I want to discuss here: domestic violence, alcohol, and children in out-of-home care. Now, in particular, domestic violence, because if we want to look at something that will really turn on that stress cortisol for the baby, it's domestic violence. And we know there is a type of domestic violence that begins antenatally. And often women can think that the baby is safe because it's in the womb. And we know, of course, that that's not true because the mother is stressed. And working towards getting everything as safe as possible before that baby is born is critical. And that's why our antenatal and postnatal psychosocial assessments, but in particular screening for domestic violence. The fact that we ask about domestic violence implies that this is an important clinical issue. The second topic is alcohol. Increasingly, we're understanding that even small amounts of alcohol early on, and indeed binge drinking, can have significant consequences on that baby's brain. And I think before we understood fetal alcohol as something that, you know, affected the heart and face if it was in the first trimester. But increasingly now we're understanding that it's a spectrum disorder and that it will impact if alcohol is drunk in the second and third trimester. You can see that it'll affect the corpus callosum and the cerebellum in particular and lead to microcephaly, but it'll also lead to cognitive impairment, not being able to have significant learning problems. And yet we know 1 in 2 women who are pregnant will consume alcohol during the pregnancy, and 1 in 4 will continue to drink once they know that they are pregnant. And we also know the power of general practice in recommending in recommending not to drink during that pregnancy. And if you have a look at the graph on the right, you'll see the purple is the load of fetal alcohol spectrum disorder, one of the leading known causes of developmental disability in the Western world. Then you can see an autism, cerebral palsy, Down syndrome, Tourette's put together. And yet this is a cause of brain damage that is 100% preventable. And this is a recent study that's shown any alcohol during pregnancy is associated with subtle yet significant psychological and behavioural effects, and that the only safe thing that women can do is abstain. And this is a study done by the Juvenile Justice Institute, the only one, the Banksia unit in Western Australia, where 89% of the children had at least one neurodevelopmental impairment, but 1/3 had a primary diagnosis of fetal alcohol spectrum disorder. And one of the ways it's manifest is you cannot learn from your mistakes. You can see the trajectory for these young people is quite sad. And then finally, the most vulnerable of children in out-of-home care, we know they must have high ACE scores to be in out-of-home care. And how can we really important role for general practice in supporting those foster carers and supporting those young children. And in conclusion, I just want to let you know that there's been a lot of work overseas just on ACE. So they haven't looked so much at the full first 2,000 days. So, and so I went to the ACE summit that was in Vancouver last year, which was the 600 general practices in Vancouver who heard about the importance of ACE the year before and then came together 1 year later to share what the different things they'd done amongst their general practice to address this information about ACE and its effect. And then this is a different approach in Scotland, where this is led by the police, where they want Scotland to be the most ACE-aware nation in the world. And I went to this and I sat down and the woman beside me introduced herself and told me her ACE score and asked me what mine was. So you can see that there's incredible community engagement with that particular study in Scotland. And in our own state, it's been quite wonderful to be part of this first 2,000 days movement, because our partners in communities and justice and education and customer service have said, this is important for us as well. And so Friday week ago, the Minister for Education went to Dubbo to launch the interagency approach called Brighter Beginnings. They all see that this is important information for all of them. And the solution is not just within health, it's within all of our partners in other agencies as well. And finally, to show you that we've got the Royal Seal of Approval with the Duchess of Cambridge, their Royal Foundation, focusing on the early years. And that we need to do this because we're going to have to spend this investment one way or another. And if we don't invest in a positive way, you can see it'll be in a negative way in child protection or in youth crime. But the reason why it's also important is the work that you do now for this generation, for the woman that's pregnant, is not just for that child, but for her future grandchild and for the generation to come. And so this is an investment not just for now, but for the next years and for the next years as well. And I am very hopeful because if you think of the elbow, a previously barely used body part, and now it is our first line of resistance. That's the place where we should cough or sneeze. It's become even more useful in getting about for traffic lights and lifts and doors, but also farewells and greetings. So that's my elbow, hopefully connecting virtually to yours to say thank you for your attention.